Idaho Matters podcast is brought to you by St. Luke's On Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on demand care for common ailments such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org. Idaho is a big state and it covers a lot of territory. Idaho Matters wants to take you to every corner of the Gem State by visiting all 44 counties, and we need your help to do that. Email us your story ideas at idahomatters@boisestate.edu for our new series we're calling Idaho 44. And be sure to join us each weekday at noon and 8 on Idaho Matters and travel the state with us. From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. In America, prostate cancer is the most commonly diagnosed cancer among men, which is why having access to good treatment options is so important. And that's why the Idaho Urologic Institute recently introduced a new procedure. It's known as high-intensity focused ultrasound. This treatment gives doctors a non-invasive way to target cancerous cells in the prostate, providing patients with an alternative to surgery. So joining us now to talk more about this procedure is Dr. Hassan Dani, board-certified urologist at Idaho Urologic Institute. Dr. Dani, nice to have you on the program.
Thank you for having me, Gemma.
So can you start out by telling us a little bit more about this treatment and how exactly it works?
Sure. So HIFU, or high intensity focused ultrasound, as you said, is new to Idaho. We just got this technology here about 3 to 4 months ago. And it's a non-invasive targeted treatment for prostate cancer. The way it works is to use, as it sounds, high intensity focused ultrasound targeted to a specific area of the prostate that we know that has cancer. And it heats that area of the prostate to a very high temperature, about 80 degrees Celsius, and thus essentially destroys that part of the prostate while sparing the rest of the prostate that may be normal and non-cancerous.
So you mentioned that it came to Idaho about 3 or 4 months ago. So this is not necessarily a new procedure, but it's new to our area.
Yeah, so it was first FDA approved, I think, back in 2018. The technology has been around for several years. I mean, even before that. It just has not been very widely used early on. And I think some of that was, I think, a healthy reservation about whether this was truly an effective treatment, an effective enough
Mhm.
treatment to offer to our patients. And so we are certainly seeing much more wide adoption of it nationwide now, and it's becoming a much more commonly utilized treatment in this day and age.
What made you decide to bring the procedure here and start doing it in Idaho?
Well, I mean, as you said, prostate cancer is really common. We treat many men daily with prostate cancer, and I think always our ability to diagnose and treat is becoming more and more advanced. But there's no question that some of the traditional treatment options that we have for prostate cancer, they have side effects. And we work with these patients for years and years following treatment for their prostate cancer, and always looking for treatment options that we can offer them that will effectively treat their cancer while mitigating or reducing some of the side effects that we frequently see. And I think that's the biggest motivator.
So do you have an idea of what prostate cancer rates look like here in Idaho?
Yeah, I mean, in general, prostate cancer is diagnosed in about 1 in 8 men in the United States. So over
Mm.
300,000 cases per year diagnosed in the United States. The rates in Idaho are on par. There's about just under 2,000 cases per year diagnosed in Idaho, and about 200 deaths per year in Idaho from prostate cancer.
And I understand that there are only a few doctors here in our state that are trained on this procedure. So, for you, why was this technology something that you were interested in?
Yeah, I mean, I think it's always important to stay cutting edge and up to date on new technologies that are available. And as
Mhm.
this treatment became more and more proven, there's more and more data to support its use in the recent years. We became motivated to offer this to our patients. I mean, there's a certain point where occasionally, even before we had this technology here, we would have patients inquiring about it because patients are, in
Hmm.
this day and age, very well informed and great advocates for their health. And so I think the biggest motivator was knowing that, well, we believe that this is an effective technology and effective for our patients. And it's important that we bring all treatment options available. I mean, not every patient is necessarily a perfect candidate for HIFU, and so I think we're still
Hmm.
certainly fairly selective and cautious about who we offer it to. But it's certainly something I think that is necessary for us to be able to offer to our patients.
So, can we talk about what patients qualify for this procedure? I mean, I think that's very important to know.
Mhm. Yeah, I think some of that is still being fully defined, and that answer may be different now compared to 10 years from now. And it may be different also depending on who you ask. But I think in general, this, because it's a non-invasive and importantly a targeted treatment, it is most useful for patients that have sort of focal prostate cancer. There are certain patients that have cancer throughout their whole prostate gland, and those patients may not necessarily be the best candidate for HIFU. Because if we're treating the whole gland with this ultrasound technology, then we might be increasing their risk of side effects. It's really
Mm.
best for patients that have sort of a focal or small amount of prostate cancer in a certain side of the prostate, and patients that don't have a terribly aggressive or high grade prostate cancer. We're still mainly employing this for patients that have sort of a low to intermediate risk prostate cancer that we think can be effectively treated with this less aggressive treatment modality, while also again mitigating their side effects.
Mhm. And what are the benefits of this treatment outside of the side effects? I mean, I would think one is that you don't have to go under the knife.
Yeah, I mean, the recovery in general is easier from this than traditional things that we think of like surgery or radiation. I mean, both of those, both surgery and radiation, are done much better and better tolerated today than they were 10 years ago and certainly 20 or 30 years ago. But there is still certainly a recovery period associated with surgery, even if it is a robotic surgery. HIFU requires no incisions. It's outpatient, so you go home the same day. I mean, inevitably, patients are still a little bit slower for the first few days as they're recovering from anesthesia and from the
Mhm.
procedure itself. But there's no question that this is I think, a more seamless recovery than some other treatment options.
So, with it being an ultrasound, is it just a one-time procedure, or does a patient do this numerous times?
Well, the goal is to hopefully do it just once and be done. We do monitor patients closely after a treatment like this to make sure that we don't have concerns about recurrence of prostate cancer. That's a risk no matter what treatment that you have up front, and that is a risk with HIFU as well. And so the goal is to do just one treatment. But if in the future there is concern for recurrent prostate cancer, then certain patients might be candidates for another round of HIFU.
So, how often should men be getting screened for prostate cancer?
It's a good question, and I guess a controversial question.
Yeah.
I think most several years ago there was sort of a shift in the dogma here in the United States about prostate cancer screening, and I think it's shifted back to where we were, 10, 20 years ago, which is that most men with around the age of 50 to 70 should be screened for prostate cancer. Most of those men once a year. Certain patients, maybe even less than once a year, if we feel that they're fairly low risk. But certainly, I would say most or all urologists, and I think the general medical community has gone back to generally encouraging prostate cancer screening for most men, and in particular for men at higher risk, which are men with a family history of prostate cancer. They would themselves would be at higher risk of developing prostate cancer. Black men are at higher risk, or men with certain genetic mutations, like the BRCA mutation, which we hear about very commonly in regards to breast cancer, is also a strong risk
Mhm.
factor for prostate cancer. And so, men that are at higher risk, no question, these men should be screened.
So I want to start. I have two questions, but I want to start with one. So if you are a man that's at a higher risk? As you mentioned, maybe you have a family history. When should a person like that start getting their prostate checked? Like, how old should they do this?
So men that are particularly at higher risk, have a family history, there is data to support those men even getting their first PSA check, which is a blood test, that's a screening test for prostate cancer, to get that done even around age 40 to 45. And
Hmm.
the result of that PSA test at that early of an age is a helpful predictor. Well, one, it would help tell, is there a risk of prostate cancer right then and there? For most men, no. But it also gives an answer of their long-term risk of prostate cancer, meaning what's their risk of developing prostate cancer 10 or 20 years from now. And so for men at high risk, I do encourage them to get that first PSA around age 40 to 45. Now, those men, if that PSA is reassuring, may not need annual screening, but perhaps might come back in 5 years or come back at age 50 and then proceed with more routine screening.
So then, all other men who aren't in this category, does that does prostate screening, or should it start at age 50?
Yeah, I mean, every organization that you ask has a different answer, but most align that it would be around age 50 to 55.
And are there anything that men can do to lower their risk of prostate cancer? Because as you mentioned, it's such a common cancer.
Yeah, that's a very good question. And there's not a lot of specific lifestyle or dietary factors that men can change that might appreciably change their risk of prostate cancer. There are certain other cancers that are very lifestyle driven, some of the gastrointestinal cancers or lung cancer, of
Hmm.
course. Prostate cancer, I think it's not as lifestyle driven. Now, we are finding for most cancers in general, and including prostate cancer, that there's likely a protective factor when men exercise regularly, are a healthy weight. We're finding that obesity is a risk factor for many, many cancers that I don't think we recognized before. Eliminating tobacco use, though traditionally people think of lung cancer or bladder cancer for smoking, it is a risk factor for developing many cancers, and prostate cancer included. But I think the biggest things are exercising regularly, being a healthy weight, reducing or minimizing red meat consumption and substituting that for fruits and vegetables and fish and poultry, is, I think, general good advice for most cancers, and
Hmm.
including prostate cancer.
So basically, the general advice for living a healthy lifestyle, right? I mean,
Yes.
this is
Yeah,
what I
nothing.
think we're always told.
Exactly. Yeah, nothing too original. So yeah, the same things that
Okay.
yeah, for general health would apply for prostate cancer as well.
And before I let you go, Dr. Donnie, is really the best way to check for prostate cancer is getting your prostate checked. I mean, doing an annual screening. I mean, and I ask this just as a woman with breast cancer. We're supposed to do self checks, etc. I mean,
Mhm.
is there anything else men can do, or is it making sure you're getting that annual checkup?
Yeah, it's just a conversation with your primary care doctor or with your urologist about prostate cancer screening, which is mainly done through blood testing via the blood test called PSA, but also through a physical exam. That's the mainstay of prostate cancer screening. There's not really any useful self-screening that can be done at home by men, and really something that I think, unfortunately, that just needs to be done at the doctor's office. We have the benefit of, most cancers don't have the benefit of a blood test that can be used for screening. It's a
Mm-hmm.
very, very useful test that doesn't exist for most cancers. And I think it's a very benign test. I think it's important what we do with that information with the PSA test and what we do in further diagnosis and treatment to make sure we're not harming patients. But the basic screening question is a very simple one, and it's as simple as a blood test.
Well, I want to thank you so much for taking time to talk with us about all of this information, including this new procedure that's available as well. So, thank you for taking time for us.
Yeah. Thanks so much for having me.
We've been speaking with Dr. Hassan Dani, a urologist with the Idaho Urologic Institute. We've been talking about a new procedure that is helping to treat prostate cancer here in Idaho. It's a non invasive treatment, as well as making sure that you get your prostate screening if you are 50 or older, or if you have a family history. Go to your doctor and talk about getting that done earlier. And that'll do it for this episode of Idaho Matters. Thanks so much for listening. And just a reminder, you can find all of our episodes wherever you get your podcasts.